Ginger.
You know what? I'm going to start out with talking about like the issues that you had before Forever Smile. So tell me, like, what's your history with your teeth?
How far you want me to go back?
As far as your story,
Oh no, I wouldn't even go back to when I was young.
how bad was it? How bad was
My first experience, I was young. I was a child, and my mother, I had to have teeth pulled. And my mother and my grandmother took me to go have them pulled. And I didn't know anything about it because I was fairly young. I must have been about maybe 8 years old, and I didn't know what to
it? Did they
expect.
numb you? No.
No, a nurse came out. A nurse, that's when they actually wore white, you know, the nurses.
Scary.
She came out, she took me by the hand, and she led me down this long hallway. I was screaming for my mother, screaming.
Oh, God.
And they laid me down on this table, and they belted me down. And they put this big black mask on me. They gave me gas, I guess it was.
What?
They put it on my
On your
mat,
face,
and it
cover your
knocked
eyes?
me out.
Oh,
That
nightmare.
that was my first experience, and ever since then, it's been a nightmare. It really has.
And unfortunately, you had problematic teeth on top.
I had, yes, yes.
So what age did they start to deteriorate your teeth?
Well, I guess they really started. Well, I was having work in my teens. In my teens, that's when it really started. And but I would just get like caps or something like that, and that was okay. But that was still torturous for me to go in there. You know, the minute I hear the drill, it was not a good thing.
Wow. Now I'm even more proud of you that you went ahead and did Forever Smile because
I'm just gonna make one adjustment on the flaps, sorry.
Yeah.
the fear factor is huge for some people. You know, people will sit in the car and knock it out. You know.
Well, the night before, you know what it was? I knew I had no choice because I had to go a few months before that. I lost a back tooth. I had to go to an oral surgeon because when it broke in my
Yeah,
gum.
yeah.
And there was no way they could pull it. And there was nothing they could do with it. It was gone. It was gone. Because it was root canal. It was gone. And it took me months and months and months to do it. I wouldn't go. And then I finally did go, and I had it done. It was traumatic for me. Yes, it was. It really was.
Awful.
It was
painful,
traumatic.
I'm sure.
Yes, it was traumatic. But I had to do it because I didn't want to get an infection or any,
Sure,
you know.
of course.
So I says, okay. But then it was after that, another tooth broke out, and another because my wisdom, when I had all these root canals, they weaken your root, and the tooth becomes like weak. It's brittle, and it wasn't supporting my caps or my bridges anymore.
Right.
So they just decided to start coming out. And at one point, I had like 3 teeth over here to chew with. And I had the bridge up here, but I had nothing down here. I had 1 tooth. So it became,
Nothing up here, nothing down there.
yeah, it became a challenge.
Yeah, that's horrible.
It became a challenge for me to eat. But I just, it was a fear. I didn't want to go through the fear, and I just didn't do anything about it for the longest time. And that's when I decided. I had gone to my dentist for a normal visit, and when he saw, he says, you're going to have to do something. He says, you're going to have to get implants. He says, and, you need one here, you need one there. He says, but, maybe it would be a best thing to look into getting, all.
Large.
He says, this way you'll have a nice uniform look. I says, okay. So
So
after
he knew about the procedure and told
he
you.
knew a little bit about the procedure.
Okay.
Yes, he did. And actually, I am going to go back to him because I want to show him my smile.
Right. Was he willing to do the implants?
No, he didn't do implants.
Okay,
He would have
so
sent.
he wouldn't have gotten the
No,
job anyway.
he would have sent me
Okay,
somewhere.
well that's very good that he steered you in the right direction at least. That's
Yes.
more than most.
Yes, so that's what I did, and that's what brought me to, well, the first place.
Right.
I'm not gonna mention.
And so, yeah, tell me about that first visit. So, okay, so you decided you really have to do something, and you kind of
Yeah.
knew the direction because the dentist
Yes.
guided you and told you
Yes.
about a full arch. Your husband had a full arch,
Yes.
but you saw what he went through, so that didn't
Well,
seem like
that was another thing too. I saw what he went through, and he did go through. It was a lengthy time, and it was getting this done, and then getting bone dry. You know, it was constant going to the dentist and doing this and waiting for this to heal. And I'm like, I don't really want to do this.
No.
You know.
Is that what you thought when the dentist said a full arch? Is that that's what you related to? Because that's what you knew.
In a way, I figured that's what it
Yeah.
was, but I didn't really educate myself until I went to the first
to Clear
place.
Choice, yeah.
Clear Choice.
Yeah, we won't say that. Don't worry.
Oh yeah, okay, yeah. I don't want
You
to.
can say anything you want. Alex will edit out anything that.
Yeah, I went to Clear Choice, and
It had-
they just took X-rays, and then the next thing he comes back with the X-rays, and he's putting them on, and he says, "Oh well, you know you." You have a lot of bone loss. We're not going to be able to give you the regular implants. You're going to have to get the something.
Zygomatic.
Yeah, okay, psychomat. Yes, and that will go up into your jawbone. And it was a little bit more expensive, but really not that much. But it was the operation itself it was a little bit lengthier, and
But that's not why you weren't happy. How did they make you feel when you went in there?
I wasn't happy. And the minute he told me that it could bother my sinuses, I could have sinuses problems afterwards. It was like they weren't giving me too many answers. For somebody who's so reluctant to go to a dentist, I need to know, I need to know. And so I put that off. I said, I'll check somewhere else.
And you had mentioned, that you didn't feel
I
like
was
welcoming, I guess.
no, not at all, not at all. And there was a girl sitting there on the desk, and she was just like the financial. She told me what it was going to cost. That was her chore in the room,
Good job. Yeah.
and I just didn't feel
You
comfortable.
didn't feel right.
I
All
did
on to the
not
next.
feel
It's good then.
comfortable.
You listened to your instincts,
Yes, I did,
right?
and
And so how did you find Forever Smile?
you know what? I think I was going through my phone, just looking for, implants, and I think I saw them, and I saw they were up in Garden City. I said, well, that's close. That's good. I said, let me try that, and I did call and make an appointment. And from there on, it just, the moment I walked in, even the receptionists, they were also very nice to me.
So it was a different feel.
It was a totally different feel. And then I went first, and I sat with Christina. She's does all the financial, and we were talking about all that and what my insurance had covered, which insurance doesn't really cover too much, but she was great to work with. She really was great, very nice to work with. And then I went in, and they took X-rays, and then Dr. Herron came
And
in.
then Dr. Herron.
And then she came in, and the moment I saw her, I said, wow, she's so young. But she made me feel so comfortable. She really did.
She explained everything.
She explained everything, exactly what they were going to do, what to expect. And she just made it seem like it's going to go great. You're going to love this. She just made me feel so much better.
Because she was relaxed, so she made you feel relaxed.
Exactly.
What did she say about the sinuses?
Well, that's why we had gone there, because we wanted to get a second opinion. And she said no. She says, and she's showing us on the screen. You have plenty of bone up here. You don't need that. And It was funny because after that visit, me and my husband, we came home, we're talking and we're talking. And I says, I just got to go back there again because I want to really make sure. And we did go back, and she went through it again with us, explained it, and that was it. I made my choice then. I made my choice. She knew what she was doing, and she explained it perfectly, and she made me feel good.
Confident.
She
That's
did.
what we talked about that before. That it's you have to feel trust, and you have to feel
Yes.
that this person is for you.
Yes.
They're for you.
Yes.
You know, not
Yes.
just the procedure or
And you know what? Every time I had gone there for like adjustment, she would always come in. It was never like, okay, we're done with you. She made it a point. She'd come in, see how I was. She
so
would,
cute.
yeah, she was
So
a
great.
doll. She really was.
So you decided to go for it. Nice.
And I did. I was like, that was it. So we made the appointment with Christina, and I followed through. How I did, I don't know, because the night before I was like, I don't know if I want to do this. But I knew I had no choice because I said, either that or I'm not going to have any teeth in my mouth.
Right. Well, you do have a choice. It's always dentures.
That was not a
Not
choice.
Thank
You know what? That
That's
was.
right.
I was told that from other. No, that was not a choice.
It's horrible.
That
It's
was
horrible.
not a choice.
Good for you. Good for you.
And I wanted something permanent, something that I didn't have to take out and clean. Well, you know what it is too? My mom and dad had dentures.
Okay, so you have hereditary on your side.
Yes.
That means, yeah.
Yes.
So you saw what they went through and taking them out, and you don't taste food.
Yes. Oh, okay. And they're not easy, from what I hear from people, they're not easy to adjust to. Some people never adjust to them. So that wasn't a goal for me.
Good
I
for
didn't.
you.
I didn't want that. So that was definitely out, dentures.
So the night before, when you were nervous, what were you? Because this always troubles me. What were you most nervous about the night before? Like what went through your mind? Were you nervous about the surgery, the outcome?
I was nervous just about the surgery itself.
Waking up.
Yeah.
Okay,
Yes.
so tell me about the anesthesiologist. Did he calm those fears?
Oh yes, he came when he came out to speak with me, and he explained everything to me. He was very nice, very nice. He came into the room with me. He was all set up, and he told me what he was going to do. And there were a couple of girls in the room too. They were all set up. You know, everything was ready to go. They were all set up.
I've done it a
And
few times.
yeah, and it just everything. It just made me feel more and more comfortable.
Good, good.
It really did.
Good.
The only thing they said to me, when you wake up, tell your husband to bring a blanket because you're gonna be cold. And I'm like, okay.
With the anesthesia.
Yes,
Yeah.
yes, but there were no surprises and everything. It went well.
Good.
It went
So you
well.
don't remember the surgery at all?
No,
Okay.
no, not one thing.
Okay. How did
No.
it feel waking up?
I was a little groggy,
Sure.
but I was aware of they were in the room, the two nurses or whatever, and they were there, and I was talking to them, but you know, I wasn't ready to get up. You know, I wasn't ready to get up
Sure.
and move, so they just were talking to me, and I lay there, and they says, "When you're ready, we'll help you up," and that's what they did. I just stayed there. And
So tell me about when they put that mirror in front of your face. What was that like? The mirror showing you your new smile. A beautiful smile, by the way. Now you're smiling.
Yeah, no. When they showed me, well, at that point I was like, but when they showed me, I was amazed.
You were amazed.
I was amazed,
Done.
and it made me feel good. Like I did it. I did it.
Proud of yourself.
Yeah, I did it. So I knew the outcome was just going to keep getting better. I knew that.
And you liked how they looked.
Yes, yes. And anytime when I would go back for like fit-ins and, they would check things and ask me, can we change anything? What don't you like? What do you like? And, and they just adjust everything. It's just simple, just simple. Just, they took them out and they fixed them. I said, wow, that's great. I says, and that left my fear of going to the dentist.
Yay.
Because I don't have to get no more Novocaine, no more drills.
Nope.
And it relieved me. It was like, I don't mind going to the doctor, the dentist now.
That's fantastic to hear.
Yes.
And that's good to tell somebody who has always had the fear.
Yes.
Dentist, and now you don't have the fear. Well, you don't have to go through anything anymore.
Right.
One and done.
But again, I would do it again. Even what I went through, the recovery, it was, but it was fast recovery, not long, but what the outcome just so outweighs what I went through. And I would do it again in a second. No question about it. And Dr. Heron, she always would say, take pictures of yourself. Keep taking pictures of you. And I was coming home taking pictures and I'm saying, people look at my phone and they'll think I'm crazy. I'm smiling. But I know I have a tendency now when I go out, I smile. I talk to people a lot more. I laugh. And, that's a good thing. That's a good thing.
That's a good thing.
Yeah.
I was going to ask you about that, about the confidence level.
Oh,
and
yes.
Before, did you cover your mouth? How did you feel about yourself?
Yeah.
After you got the Forever Smile, did you feel differently?
Yes.
Tell me about that a little.
I felt, that was another thing too. I had lost one tooth here, so every time I smiled, you could see that space. That was embarrassing. But now I can smile, and I have a smile. I have teeth on both sides. I have lower teeth, and they're just, I really can't, I get so overwhelmed with it because I'm very happy.
People who have never had dental issues have no idea
I know. No.
what life is like when you have dental issues and you can't chew. Tell me about eating before.
It wasn't good. It wasn't good. I had to always make sure whatever I ate was soft. I mean, even when my husband, we go out to eat broccoli, I would always have to tell him, I like broccoli. I says, but it has to be well done.
Yeah.
Because if they brought me back crunchy broccoli, I couldn't eat it.
Right.
I couldn't eat it. And there were a lot of things I couldn't eat. Like an apple now. I'll eat an apple. I love apples. But, I mean, I like to cut them up because that's just me, how I like them. I don't like biting it, but like a woman, I just want to... But I love them. I eat them, and the crunch on both sides of my mouth, it's wonderful. No, it really, see, I sound like a crazy. No.
It's not crazy.
It's wonderful. It's a wonderful feeling that I finally can eat because I didn't eat for years.
Oh my God, it made me cry from that. It's amazing.
For years.
It's a lifelong journey, and now to be at the end of it, be able to enjoy life on a different level.
Right. And that was another thing too. I was like, oh my gosh, why am I doing this now at my age? That was another thing, I said,
And what do you say to that?
well, when I was contemplating about doing it, I kept saying, why am I doing this? This is a lot of money. Why am I doing this?
And how did you answer yourself?
But it got to a point, and I did speak to other people, and they all said it was, they're happy. They're happy that they did it, and it doesn't really matter how old you are. If you're happy and you can eat well and you can smile, it's...
There's no price tag on that.
No, there's not.
Yeah.
And that's what changed my mind.
The answer is You're never too old.
No, no, no. And I'm living that right now because I actually feel that.
That's so great. That's so great.
I am. So
I
it's
love that. I love that. You're able to eat and smile and just not have to deal with that anymore.
more.
I'm relieved for you.
Right. And I know when people are looking at me, they're not looking at what,
Right.
they're looking at a nice smile, and it makes me happy.
And your smile makes other people smile. too.
Yes.
So
Yes.
it's a gift you can now bring to other people.
Yes.
Right?
Yes.
And I feel like you're the type that would just love that.
Yes.
You made somebody else smile because of your bright smile.
Smile. Yes.
You brought a gift to somebody that day.
Yes. Yes.
That's awesome.
It is.
What would you tell somebody who is on the fence about getting this for whether maybe they're afraid? What would you tell them?
Well, if you're afraid, do it. No, I'd do it. I really would, because I was fearful. I was very fearful. I really was. And I was a dental nightmare. I was.
You're not alone. That's for sure.
Yeah, and no, I would definitely say do it. If you can do it, do it.
I almost wish with people that have fear to go back in your head to when you really had that fear, and if you could talk to that other person as the person today, like what would you say? I wasted time being scared, all kinds of thoughts.
Yeah, because
Like that,
I
right?
I really did. But at one point, I was getting along because they just kept putting crowns in, bridges in, and it was money, and
And you keep on
but
going.
and it kept on going, and then there was always other problems underneath, and it was like, what am I doing?
It's a Band-Aid.
Exactly. And I'm glad I got to rip it off and start now.
That's a good way to put it. Rip off that Band-Aid
Yes.
of fear.
Yes.
I like
But
that.
anybody, I would definitely say do it. I really
So
would.
just do it.
Just do it. Let
That
the
your
fear
fears
let the
were-
fear go, because it really isn't that bad. It's not. It really isn't. I think a fearful person projects more than what it really is.
Yeah. And
And
I also can relate to the fact that when you go to the dentist and you have a root canal or whatever, it's painful.
oh yeah.
It's a painful thing. So to imagine all your teeth being pulled, it must feel like it's going to be tremendous pain. And it's not for
No.
every patient, I'm told that.
Yeah, no, and plus too, they were so weak. They just came out because all the roots were so weak.
Right.
So
Unbelievable.
it
So
was like
happy.
eventually they were coming out. So,
Whether you wanted it or not.
but I did the good
Oh,
thing.
my
I jumped ahead of it, and I'm glad I did.
Well, you really did great. You did a great job.
Yeah.
Thank you. Is there anything we didn't talk about that you want to say or mention?
No, I just want to say I'm so happy that I went to Forever Smile. I really am. And that I met them all there, because they changed my life. They changed my life. They really did. See, I could cry, but they did.
I love that. You made me cry.
Yeah. Yeah. So I would definitely recommend it.
Well, I couldn't be happier for you. And more importantly, proud of you getting past the fear. That's the hardest part. But you came out the other side, and now you go on.
Yes. And I'm loving it too, and I'm loving it.
I would adorable.
Yeah.
I think we're good. Yeah.
Okay.
Oh, I gotta put these down, puppy. Well, you did really great. Thank you for being so honest and open.
Well, I try to. Sometimes I just